wonder, do any of us actually know what it's like to be healthy anymore? Because we're not supposed to have this toxic overload. Everyone watching this, everyone at Whitehorse, you all have glyphosate in you. If we tested you, you've got glyphosate, just to pick an example. And that is an awful chemical for you to have in you. So we've all got this toxic overload. Now let's talk about nutrition in our foods. I'm going to say something revolutionary, and it might shock some of you. I'm being facetious here. Did you know the human body needs certain nutrients to be healthy? Who knew? Well, actually, we all knew. And if you're not getting the nutrients you need to be healthy, then you become unhealthy. And then you become chronically sick. And then you go to the only medical system we have where the only legal treatments are synthetic chemicals, by and large designed to treat symptoms of chronic illness. And now we'll be treating the symptoms of your malnutrition. This is our model. This is the world that you live in. You know, speaker after speaker after speaker has been making it clear to us, you cannot get the nutrients you need in our food supply. Our food supply is literally dangerous now. You know, the United States Department of Agriculture regularly surveys food to measure the amount of nutrients in it. And, you know, 100 years ago, you could just eat fruits and vegetables and grains and get all the minerals, just to speak of minerals, let alone vitamins, that you need. Like, you didn't need to supplement. Our food was food. Our food, we eat food to get the nutrients we need to be healthy, not just survive, but to be healthy and thrive. And our food did that. And now it doesn't. I think, I could be wrong on the year, I think it was their 1949 report, where they went out of their way to sound the alarm and say, you know, we're losing these nutrients. And if you're missing this nutrient and this nutrient and this nutrient, you get this chronic illness. And if you're missing this nutrient and this nutrient, you get this chronic illness. This isn't a surprise. This isn't unknown. But we've engineered our food supply where it is impossible for you, even if you're eating healthy, even if you're eating organic and raw and doing everything right, you can't get what you need to be healthy. You know, we had Udo Erasmus as one of the speakers in our Vancouver event, and he says there's this list of essential nutrients. And they call them essential nutrients because if you're missing even one of them, you will die. You become chronically ill and die. And we can't get what we need in our food supply. You literally have to supplement. But Health Canada, and it's how you know this is by design. I mean, we've got this toxic load. We can't get the nutrients we need in our food. And then the third whammy is it's actually illegal for supplement manufacturers to give you supplements with the dose you need to be healthy. We have what's called recommended daily allowances. And if you followed them, you're going to be chronically sick. And I've represented manufacturers. Health Canada goes after them if they try and give you more than recommended daily allowance. One of our speakers is Dr. James Lunny, who speaks about vitamin D and how Canadians are chronically deficient, especially in the wintertime. You know, we don't have a flu season, we have a low vitamin D season. Well, you guys up in Whitehorse, you get so little sunshine in the winter that you must supplement with vitamin D. Well, it's only legal in Canada because Health Canada restricts us to sell you vitamin D where the maximum dose is 2,500 international units. That's micrograms. You can't be healthy on that. You can't. You can't have a healthy immune system. You can't function. You have to have way more. Isn't it interesting by law? You can't have more. You have to have somebody tell you to ignore the label. That's where we are in Canada. And that's why what you're participating in is so important.